Taylor, thanks so much. It is 7:17 this morning. The government shutdown could also impact your health insurance premiums. With open enrollment now underway, some people are seeing larger spikes in their monthly insurance costs. So what does the shutdown have to do with those spikes? Joining us now is Bryan Rotella, a healthcare attorney. Bryan, I appreciate you joining us. Let's begin with the factors that are creating the spikes that we're seeing.
Well, good morning, Marissa. So let me break this down for folks because I think we've made health insurance in this country, if you remember the Rubik's Cube, I think we made it even more challenging than that. What's going on is this. With Obamacare, which we all likely remember was passed in 2010, Obamacare's original intent, remember, was to have folks that were young to get on insurance because they often didn't get insurance. Remember the individual mandate where they were going to be penalized if they didn't get insurance? That ultimately went away. Young people weren't doing it. And then secondly, back in 2017 in the tax bill, that penalty went down to zero. So there's no penalty. So what happened? We have to rely for the Obamacare plans on what are called subsidies, where the government actually is subsidizing for people. And these are folks who are on the Obamacare plans, folks who don't have employer insurance. They're not part of Medicare, meaning they're not over the age of 65, and they don't apply for Medicaid. Okay. So those folks get subsidies to ultimately be able to have access and to afford the plans that are on the Obamacare exchanges. But Marissa, here's the problem. Right now, those subsidies are going to go away, at least what they were at of the levels during COVID. Those subsidies were raised because of the more health concerns during COVID. And the whole battle we're having is Republicans are saying, you know what? We don't want to keep this Obamacare thing on life support, basically. We want to lower this again. We want to get rid of these subsidies. And the Democrats are saying we got to keep this in place because candidly, they think that it's working. My view is it's not working for the American people for three reasons. It did not make health insurance less expensive. All it did is subsidize insurance companies. And secondly, it really didn't take away our biggest concern, which is not going bankrupt if we end up having a major catastrophic health concern. And third, having worked in healthcare for 25 years, we're not incentivizing doctors for this group to be able to keep us well and keep us out of hospitals and keep us out of emergency rooms. Those are three things we're not doing right now. And we're all caught in this Groundhog's Day of, do we keep Obamacare on life support or don't we?
Yeah, Bryan, a great history lesson there as well. And I know that people expected the prices to go up anyway, even more so now with this subsidy fight. My question is, how much more? I mean, are we talking double what people were paying, triple?
Marissa, this is going to be well into that, at least 25, maybe 30% of what people are paying. And again, remember, it's not like they're going to get better coverage for that. The coverage plans are going up. This is simply to give subsidies. Basically, it's like a tax deduction that when you go on the Obamacare plan or Obamacare exchange, you're able to get access. Without those subsidies, you're going to end up in a lower plan. And those plans have extremely high deductibles. The coverage is less. This is going to be a real pain point, again, for this population. And there's so many of us who may have small businesses. We don't have employer coverage. We may be part of the gig economy. This is a major issue.
Yeah. So, Bryan, I want to make sure we only have 30 seconds here. What can people do? Because this is the situation we have found ourselves in.
First, lobby your Congress people and tell them we want catastrophic care for all. It's too late. At this point in this country, Marissa, we should have that. You shouldn't be worried about if something major happens that you don't have coverage. But in the short term, there are short-term policies that you can get. They're not great. They're temporary insurance, really high deductibles. The benefits aren't great, but you can get a short-term policy if you don't have enough of the subsidies to get on the Obamacare exchange. There's also high deductible plans that you can get. Again, it's not great. Neither of these are great solutions. I wish I had good news this morning. My biggest thing to tell everybody is we got to get our Congress folks to work harder and get a real solution to this because we can't be stuck in Groundhog's Day every couple of years based on Obamacare life support.
Yeah, there's no real trade-off here. But Bryan, thank you so much for breaking everything down for us. We appreciate it.
My pleasure, Marissa.
All right, it's time right now. It's Dakota.